afternoon, everybody. I'm so happy you're here, including Maria's cat. I'm Debbie Walter from Union Library Adult Services Program, and I encourage
Why
you
am I all of a sudden backwards?
Upside down.
sign up for our newsletter and take place in some of our fabulous events we're having. Next week, we're having the Mediterranean diet, new ideas, and then the week after that is build your emotional toolbox, which should help us all through the winter. In February, we're going to have programs about Sinatra. We're having a costume designer from Met and theater and film sharing his experiences. We're going to be celebrating Black History Month and a number of other things. But first, for today, we're really excited to have Dana Abbey, who is the Community Engagement Coordinator of the network of the National Library of Medicine based in Colorado. And Dana, we're thrilled to have you. Thanks for coming, and thanks to those who are participating. Welcome.
Yeah, thanks, Debbie, and thanks everyone for joining in. I'm really happy to be here. And since we can't be there in person, we can do it virtually. And as Debbie said, feel free to put any questions you have in the chat box, and we'll see if we can get to those today. Debbie did mention too that this session is being recorded and it will be posted to the Facebook page for the Union Public Library, but give it about a week to show up. So if you want to revisit the content or rewatch it for any of the resources that we talk about, and I will also send a list to Debbie with all the links of the websites that we'll be talking about today. So with that, I'll get started. I will share my screen. So today, I have a class that's called Does Duct Tape Cure My Warts? And it's a class to learn about resources and ways to research complementary and alternative medicine. So today I kind of want to take that overarching subject area of things that we might buy at the grocery store or at Target or the vitamin store, or just think about any modalities that we might invest money in, be it a massage or magnet therapy or whatever we could think of. But we'll tie it together with just some general principles of how do we know what we're looking at and if it's authoritative and if it's safe and if I should be investing my money, because all of this stuff costs money and time, and we don't want to do anything that's going to cause ourselves harm. Or if we're a caregiver, we don't want to cause harm to anyone that we're caring for, whether it be an adult parent or a child, a grandchild. So we'll be looking at some general principles of complementary and alternative medicine, and then some general guidelines for you to think about ways to evaluate if a resource, whether it be a website or maybe even a book, a news story, is relevant, and if you want to proceed with that information. So a little bit of background, if you're not super familiar with complementary and alternative medicine. So there's a few different terms that get bantied about. The first is complementary medicine. And what that means is that you're using something with something else. So an example of this is using aromatherapy to help with pain after surgery, in addition to a prescription pain medication like hydrocodone. And then the term alternative medicine means that we're using something in place of something else. We're not using it in addition to, but we're replacing it. So an example of this would be using garlic to lower blood pressure instead of using a blood pressure prescription medicine like lisinopril. I'm not advocating that you do that. It's just something that people have done, and it's always good to talk to your doctor before you stop or start any medication or alternative treatment. And you may also hear a term of integrative medicine or integrated medicine. And these are practices that you will see more prevalent, like in your actual doctor or clinical setting. And they're taking traditional Western medicine, like a prescription medicine, and then they're using an actual tested or researched modality in addition to it. So for example, using acupuncture for nausea when somebody is undergoing chemotherapy. So there is actual research that's been done that shows some people benefit from acupuncture if they're feeling nauseous during chemotherapy. So it looks at the science, and this is one of the key components today is the research. You know, how do we know if something's safe? How has it been tested? And we'll be looking at some resources that will do that work for you. And your job is to evaluate whether it works for you and your unique situation. So here are some common complementary and alternative medicine modalities. So I'm sure most of you are familiar with vitamins and supplements, and that could even be supplements like pea protein or vital wheat gluten, all different kinds of supplements, yoga, meditation, chiropractic methods, and acupuncture. And these are just a few. There's many, many more out there. So when we think about how all these modalities are regulated, when we look at dietary supplements, generally they are considered safe until they're proven unsafe. So this really leaves it up to the manufacturer to determine if they are producing a product that is safe and in a good manner. And the FDA does not really get involved in the testing of your vitamin E that you buy or your B12 supplement. They just have, they're like, we put it out to the manufacturers to ensure that they're creating a safe product. We only get involved when something bad happens. So that's not very helpful to us as consumers. But it does help us remember that, we shouldn't just be taking things willy-nilly and just pulling things off the shelf and taking it. We really need to think about our lifestyles, what we might already be taking, any health issues that we might have, our diet, how much exercise we get. There's all sorts of things that comprise what makes us healthy. A lot of the body and mind practices are regulated at the state level, or maybe not even at all. So when we think about something like a massage therapist, in general, they are required to have a license at the state in which they practice. There might be other groups or other therapists that you look for. Maybe you're interested in magnet therapy or music therapy, and in your state, they may or may not be required to have any kind of licensure. The one good thing that helps with the licensing part of it is that you can go in your state, and I've listed the link here. You can look at professional licenses in New Jersey, and you can find out if they're still current. Have they had their license revoked? Has their license expired? And that's all really good information, because a lot of these CAM practitioners, it's not inexpensive to go see them. A massage therapist could charge anywhere from $60 to $150 an hour or more. An acupuncturist could charge, $100 an hour. So you want to make sure that you're getting a trained, licensed practitioner if your state requires that they have licensure. And that's not to say that the other modalities that don't require licensures, that they're not worth seeing. It's just that your state has determined that it's not necessary that they have a license. So this is an example from that website that I had listed in the previous slide of massage. It's just a little screenshot of massage and bodywork employers and employees in New Jersey. And so we can see, like over to the right, there's been a few that have expired their license. Maybe the actual location is closed. Some of them have pending licensure, so they could be new to the profession or new to the state, and they haven't gotten the license approved yet. And a lot of them are active. So it gives you a really nice snapshot of what the state of New Jersey is doing to keep you safe. And it also gives you an opportunity to find out if there's been any board actions. And this is also true of any physician or nurse or any other licensed care provider, dentist that you might have. So it's a really great resource that all states have to sort of track what's going on with the healthcare providers in your state. So here are some examples of questions that we get at the library. And I'm sure Debbie has gotten some questions, and maybe she'll get more after this. You guys, I'll be calling her for information. But you can kind of see the variety of questions that come up and how complicated they might get. One, shark cartilage. That's a pretty common alternative treatment in parts of the world, but it's not necessarily one that has had a lot of research done on it. So, and we're dealing with cancer, that's pretty serious. We don't want to start a treatment of something that's not going to be effective. So you can see how complicated these questions get and why sometimes it takes a little bit of time to answer the questions. There's not always one single answer or one single resource. So sometimes researching your health is a little bit of a time investment on your part, but I think it's well worth it. And please remember to use the fine resources at your public library, one, which is the librarians and the library staff. They deal with databases all day long, and they can, they know which ones will be the best ones to get you started. So I always think it's great to recommend going to the library first or giving them a call, since we can't get into the library right now, but hopefully soon we'll be able to. But there are, if you want to get started on your own, we'll be talking about some resources in a little bit that you can look at from home. They're freely available to you. There's no cost. They do not collect any information from you, and you can get some really great information. So let's talk a little bit about what constitutes good information on the web. So anyone can put information on the web. They don't need to have a license to do it. They don't need to be an authority in the area that they're posting information. So if you think of it through that lens, we really want to sort of condense, how can I quickly assess if a website is, the information I'm getting from the website is worthy of my attention and time. So we want to look first at who runs the website. So any website should make it easy for you to learn about that. There should be an About Us or some kind of button that you can push if it's not right out in front that gives you more information about who is behind the website. Who pays for the website? This is important. One, it's, running a website is not free. There is a cost to it. There's time. They might be paying for the information that's getting uploaded. They're paying for their unique URL address. So there is some money behind it. And is there any bias to the information they're provided because they are trying to recoup some of the money that they are putting out? In general, if we look at websites that end in .gov or .edu or .org, those are generally nonprofit. They're not out to make money. They're not trying to sell you something. But you also want to make sure when you look at the website, if they have advertising, which isn't necessarily a bad thing. I mean, when we look at a website like WebMD, there's a lot going on their pages. They do provide some really good health information, but you have to kind of put your blinders on and not look at all the ads that are popping up on the sides and trying to sell you something. So you kind of have to weight the information you're getting with maybe some of the background noise that's occurring in the web page. And what is this website's purpose? Why are they really there? Are they trying to sell you something? Are they trying to promote a book? Do they want you to subscribe to something? Or are they really just there because they want to share really great health information with you, or any kind of good information, health or otherwise? And what's the original source of the website's information? Are they pulling articles and information from other websites? Is this research that they've done on their own? Are they writing their own papers on this? You know, what's their area of expertise? And how do they document the evidence? Are they quoting scientific studies? Are they quoting public health departments or renowned experts in the field of the health topic that you're researching? And did anyone review the information before they post it? Do they have a list of people who provide content? A lot of these medical and health websites will give you a list of all the people who create content or review content for them. And we'll take a look at a couple of those. And oftentimes they're currently practicing in medicine. It could be a nurse, it could be a dentist, it could be a surgeon, it could be a researcher. So, you know, just knowing if the person reviewing the information for authoritativeness, you know, you want them to have some level of authority to be able to make that call. And how current is the information? I mean, does it look like the website hasn't been touched in about 20 years? Do they have current information? You know, is everything 10 years old? Maybe they're not updating it, or, you know, and it could be anymore. It's pretty rare that something hasn't been researched, at least within the last 5 years. But there are occasions where things just haven't changed. So the last seminal research was done in 1999, and that's rare, but it does happen. But I would say within the health field, you really want to look for information that's been published in about the last 5 years, because things are changing so quickly. We're learning so much more about our bodies, our DNA, how medications are uniquely metabolized in your body. There's lots of things that we're learning that we didn't know before. So there's a lot more information out there than there used to be. And another thing to think about when you're looking at the website is, do they talk about their policy for linking to other sites? So some sites will not link to other sites that have advertising, or maybe they'll link to a site that has advertising, but they have to have listed the authoritative people who are behind the content. So you want to know what their policy is for linking to other people's content. And do they collect any information about you? And if they do, what do they do with it? And can you opt out of that information? Are they not going to give you the information unless you give them your email address? Well, maybe you don't want to go down that path with them, because there's a clear reason why they want your email address. They're probably going to try to sell it and make some money off of it. And with all these things coming together, that will help you formulate whether the information that you're going to be reading on the site has any level of accuracy. And that's where, too, the library can be really helpful. You know, maybe you come across something you're researching at home and you're just not sure, you know, you're like, it seems kind of legitimate, but I'm not really sure. you know, you can check with the library and they can help you look at the website, look at the information that you're getting, and kind of put another set of eyes on it to verify the accuracy. So because they're so prevalent, I just threw in a few tips for using dietary supplements. So most of us do not, probably about 50 to 60% of us, when we talk to our physicians, our family doctors, we forget to mention that we take over-the-counter supplements. But it's a really good thing to make a note of and share that information with your doctor, especially if you're taking any other kind of prescription medication. Because you want to think about your diet in its totality, because too much of certain medications or nutrients, can cause problems. You want to discuss any current or future supplement use with your care providers. There are some interactions, and I'll give some examples a little bit later, of interactions with, you know, common everyday over-the-counter things with prescription medications. And some supplements can cause unwanted effects during surgery. They may allow you to not clot properly, which you don't want that to be a problem. And again, as I mentioned before, manufacturers are responsible for the safety of their products, but you can report any adverse effects to the FDA. You don't have to wait for it to be recalled. And you can find out from the FDA about all their recalls. And this covers recalls for anything like grocery items, medical devices, anything that's been put onto the market that you can ingest, or, you know, a cream maybe that you put on your face. The FDA lists all the recall alerts on their website. So one of the sites I'd like to start with is Medline Plus. Have any of you ever used Medline Plus before? It's a resource from the National Library of Medicine. It is completely free. It's in English and Spanish, and then there are probably about 80 other languages. So if you have a family member whose primary language is not English, most people prefer to read legal documents and medical information in their primary language, even if they're fluent in another language. So if you have the need to do any language searching, Medline Plus would be a really great resource to help fit that bill. You can search any variety of health information, not just complementary and alternative medicine. It has all manner of health information, drug information, surgery information, lab test information, all kinds of things. So I'm going to go, we're going to go live to the site right now. And let me get that pulled up for you real quick. And let me share my screen again. All right, so this is the homepage for Medline Plus, and the URL is pretty simple, medlineplus.gov. But you can search a variety of health topics, drugs and supplements. You can find out information on genetics, any medical tests that you might be getting, and there's a lot of videos and tools that you can also utilize. So let's look at some of the health topics here. So you can look up a disorder or a condition by its name, but if you're also interested in a particular body system, you can look at all the things that might affect a particular part of your body. You can look up any disorder or condition, any kind of diagnosis and therapy. And here's one just on complementary and alternative therapy. We'll take a look at that. And you can also look by the demographic group. So if you're looking for information just for men or just for women, or an age group, maybe a child or a teenager, you can narrow it down to that as well. So I'm going to go ahead and click on complementary and alternative therapies. And what we get is a list of all the different therapies that are out there. So we have here on this list teas, homeopathy, integrative medicine, non-drug pain management, chiropractic, dietary supplements. So we'll just click on one of these and see what it tells us. And the great thing about Medline Plus is all the entries, no matter if you're looking up something on breast cancer or dietary supplements or foot pain, the page is laid out exactly the same. So you get used to where to look for the information that you need. So it'll give you a nice summary of what dietary supplements are. It links out to some other resources. So we talked about before, you know, where are they linking out to? So we can see that they're linking out to other National Institutes of Health institutes or Health and Human Services sites. So we're getting good authoritative resources. And any related issues, in this case, any alerts and advisories, how to maybe discern if a dietary supplement is fraudulent, how to learn where it's being made and where it comes from. And then specific, if you want to know something specifically about probiotics, you can search something there, omega-3s, clinical trials, and journal articles. And the journal articles are articles that are published in a resource called PubMed that we'll be looking at. And this is where a lot of healthcare providers get their information. It's where researchers publish their data from their research. I will say I do not have a science background, and sometimes they're not the easiest articles to get through because they are written pretty scientifically, but they can also be a great starting point for a conversation with your healthcare provider. So before we started on the call, Debbie had asked about melatonin. So I'm going to go to the drugs and supplements section and just click on the M's, and let's see if melatonin is one of the things that they have. And if it's not, that's okay, because we've got some other resources. So you can see how robust this resource is, and it's because it's including prescription drugs in addition to over-the-counter things. So I'll just kind of scroll through here and see, did I miss it? I don't see it, but I'm going to try another search. I'm going to go back up to the top of the page. And I'm just going to put melatonin in the search box and see what comes up. Oh, I know why, because I was in the drug section. Sorry, not in. All right, so we can see here that we've got 75 articles or entries that have a discussion of melatonin. Melatonin may not be the main content of all of them, but it's got enough coverage that they have flagged it for the search that we've done. So this particular entry was done by the American Academy of Family Physicians. So I feel that would be an authoritative resource. And it gives us, boy, that looks like me last night trying to fall asleep. Gives us a little bit of information on what melatonin is, how it might be used to improve health, what to think about when you're taking it. There might be side effects, known side effects about it. Of questions to ask your doctor before you use it. And here's a really important thing to look at. When, we talked about the currency, like when was the information written? So they just updated this last June. So that's really great. They went out, they looked at the current research, they looked at what they posted, and they made sure that it was up to date with the most current research. And now we know that they have done a review of it. That's pretty current, so that I would feel okay about sharing this information with a patron if they came into the library. So that's a look at Medline Plus. And I think, as I mentioned, you can really use this to research anything, not just complementary and alternative medicine. This is really the gold standard for consumer health information. And you can really find a lot of really good information. And it's written for the consumer. This is not written for anybody, in a scientific field. This is written for people like us who don't have a medical background. So I really appreciate having access to this kind of information. All right, another resource that we'll look at is a center that was given funding almost 30 years ago, believe it or not, just to study complementary and alternative medicine. And a few years ago, they changed their name to Complementary and Integrative Health to sort of reflect the fact that they are contributing to the body of science. So the whole point of this center is to look at studies, to develop studies, to work with universities and people developing modalities to create a study to see if something does work. So some of the things that we want to think about when we look at a study, some of the things that come out with alternative medicine, it's a little tricky because you'll find the study, I always look at how many people were in the study. If it was only like 5, I don't really know if that's a good number, but sometimes it's all we have. And do the study participants reflect me? Were they all 18 to 22 years old and they were male? Well, whatever they're studying may not work so great for me as a middle-aged female. So we kind of have to look at how the study was put together and take the information with a grain of salt. And again, in conversation with your doctor, if you think it's something that you'd like to try, but maybe the study doesn't necessarily reflect your gender or your age or your particular circumstance. But the great thing about this site is that it's all about alternative medicine. So if you want to look up information on a particular topic, an herb, safety information, it's all here. So we'll look at some of the topics that they cover. So they put everything all together. So you can look at modalities like acupuncture and anxiety, but they'll also combine it with all of the things that they've studied, like supplements and things like that. So maybe I'm interested in this entry on anxiety. And it gives you a little overview of what it is that we're talking about, so everybody's on the same page with the definition. It gives you information on what scientific studies have found. So like, are there any mind and body practices like meditation or hypnosis? Do any of those things help? Well, they've done studies, and you can read about those here and see if it's something that you want to investigate. They also list if there's any products like over the counter, like a tea, or is licorice good for this? Is vitamin B12 good for this? If there's any kind of supplement that's been tested for it, they will discuss that here. And then they'll also talk about any known or identified side effects or risks of any of the research that that was identified in the research studies. And here, this was last updated December 2018, so that's fairly current. They are looking at all the research, and they don't necessarily go back because research studies are very expensive to do. They're not necessarily going to go back every year and see if they get any different results over using Reiki for anxiety. Everybody's battling for the research dollars, and the research that's looking at saving lives, doing cancer research and things like that, really does take precedence. Not that this is not important, but you can kind of see, like, if there's only so much money to be given out, where do we want the money to go to initially? So I think that 2018, they've reviewed this and updated it, is very current, and I would feel comfortable referring people to this page for that information. Let me know if you guys have any questions as we go along.
I've muted everybody. I'm going to now unmute everybody.
Yeah, if anyone has questions, or you can put them in the chat box. I can't see the chat box just yet, but I'll revisit that when I stop sharing.
I'll let you know.
Okay, great. Thanks, Debbie. All right, another great site that is free to you is the Office of Dietary Supplements. And I really like this site because they offer, if we look at the center of the page here, they have these dietary supplement fact sheets. So if you're taking a dietary supplement, you can come here and see, let's just take a look at like vitamin A. A lot of us are taking vitamin A. We can see there's a consumer version, there's a version in Spanish, and then there's a version for the health professional. And even if you're not a health professional, it does not preclude you from looking at it. I look at them. But we'll go to the consumer one just so you can see what it looks like. But it gives you a little overview of what vitamin A is and what it does, why we need it and why we might take it, or why we might need to supplement our diet with it. It gives you the daily recommended amount based on your gender and your age. It gives you a nice overview of, maybe you don't need to take a supplement, but you want to kind of boost how much vitamin A you're getting. You can find out how you can do that through your diet and which foods provide vitamin A. And then what are some of the health consequences if you don't get enough? And then information on, you don't want too much of it. And any interactions that you might have. So there are some known interactions with some medications. And hopefully this is something that like your pharmacist would flag for you. But if it's not in your medical record that you're taking vitamin A, they won't know if they give you a prescription drug where it might interact with it. So that's why it's always good to make sure your doctor has all the over-the-counter medications you're taking in your medical record. All right. So another resource we'll look at, this is the one that I mentioned where your doctor will get articles or the clinical researchers publish their information. So I don't want you to be frustrated by going to it or looking at it because it is pretty high level. Some of the information, it's hard to know, like, well, was the study a good one? Because in most science, it's very hard to definitively say, this is the way to do it. They can say, this is the way we did it in our study, and these are the results of our study. But it's very difficult to then extract that information and say, for the general population, this would be great for everybody. So science always approaches their articles and the release of their information with a little bit of caution. because everyone is unique. Everyone has a unique perspective and on their health and health needs. So they can't say definitively that this is the best thing ever and everyone should do it. But they do try to give you a glimpse into what they found. And if they think, based on the results, is it worthwhile doing more investigation on? So let's see here. There is an easy way you can search specifically alternative medicine. And this database, let me just highlight, just to prepare you, it has 30 million citations in it. So the chances of getting a lot returned when you put in, if you put in something like osteoporosis, you're going to get a lot of information. But that's good because there are ways to narrow down your search. I will say that with this database, the other resources that we've looked at, you get the full text. Like there's no, when there's an entry on vitamin A, you can read everything at your desktop and you can print it off, you can share it. With PubMed, it's a little different. This is PubMed does not publish the journal articles. These are articles that are being posted by journal publishers. And for the most part, they want to make some money. So they generally give the abstract. So it'll give us a little bit of a clue as to whether this article is worth investigating. Now, a few years ago, the National Institutes of Health said to researchers, all right, researchers, if you're going to use public funds to research your whatever it is you're doing in your laboratory, and you publish on it, within a year of publishing, say, in the Journal of the American Medical Association or the New England Journal or wherever they might publish, within a year of that, you also have to make that information available to the general public because they funded that research. So you will find a lot more of the full text of the article right at your desktop, more than we ever have in the past. So it's a really great thing that they've done to bring this research to the general public because you paid for it with your tax dollars. So let me just show you an example. I'm going to look up osteoarthritis, but I want to narrow it just down to a subset. And this is where I'm going to type in CAM. So I only want to look at modalities of complementary and alternative medicine as a subset. So I put SB in little brackets. So this way it tells the system that I don't want 30 million citations. I'm only looking for osteoarthritis that deals with anything complementary and alternative. Oops, I must have spelled it wrong. Hold on here, 1 second. Well, that's weird. Let me try something else. Let's try. It could be sometimes some of the subset searches get a little kludgy and well, I'm not sure why it's not finding it. That's really weird. Well, this was a really good example, wasn't it? Let me just try cancer and just because I'm trying to show you guys what you might find when you get there. So in that search, I'm not sure why it wasn't working. I will find out why that subset is not working, but we just put in cancer and complementary medicine and it returned to us over 25,000 articles. That's a lot of articles. But what it does is it gives us the most recent articles first, which is what we want. We don't necessarily want anything. You can see on the left-hand sidebar here, we have articles back to 1946. Probably not as helpful if we're looking at things that have been recently researched. So we can go through here and find out what kind of articles we have. They give us a little bit of a abstract here. We can click on any of these articles and it will give us more information. And the thing that I like about PubMed is if you find an article that you really like and is really on target and you want to talk to your doctor about it, it also brings up a list of similar articles that you might be interested in that are either by the same author or involving the same information that is found in the article that you're interested in. So I think there's a really great way to find articles really quickly. So I don't want to spend too much time in PubMed because, like I said, it is not all full text. That's one of the drawbacks to it. But I think it's a great resource if you do have a health issue or you're helping somebody, try to find some health information or find some, what's happening in current research for complementary and alternative medicine. That's the place to go. I think it's a really good resource. The last thing that I want to show you is clinicaltrials.gov. And this is the repository for all the research that's being done around the world. So if you want to find out, have there been any, let's see, I'm going to see if there's been any studies with coffee. So I'm just going to put in a search term. And there have been over 344 studies looking at coffee for one reason or another. So it will tell you if the study has been completed, if they're recruiting or not, if the study has stopped, if it's unknown, maybe in the cases of the unknown, they may be working with their funder and they don't quite have the funding yet. So they're, answering questions and getting some feedback on the study protocol. But these are all, this is kind of a fun database to play around in. If you're trying to find out, has a study been done on X, Y, or Z? Or, you can even be more specific and say, looking at coffee and insomnia. So they've done 2 studies that look at insomnia where coffee was somehow introduced into the study. So you can do a whole manner of combination of things just to see what is happening in the world. And maybe you want to be involved in a study. So we can look at one of these. Let's see if we can. We'll do the example of coffee again. And we can tell it as a status, are there any that are recruiting? And we have 43 studies that are recruiting. And you can go into the study and it will tell you where they are running the study. Sometimes they're run at only one location, like a clinic or a hospital or a university. Other times they have trials that are being done all over the United States. So in this case, it's being done in Ohio. So if you know anybody in Ohio that wants to be in a coffee study, there we have it. So those were the databases that I wanted to show you. So let's revisit. So we've got Medline Plus. We have the National Center for Complementary and Alternative or Integrative Health. We have the Office of Dietary Supplements. We have PubMed and clinicaltrials.gov. So I think between those resources, you should have a really good ability to access current research that's being done to see if something is effective or not before you spend money on it. And I'm going to stop sharing so I can see the chat box. And Debbie, would you like, I can send you all the links, and do you want to add that to the Facebook entry?
Absolutely.
So I'll
What
send-
I always send, I'm sorry for the weird video here. I always send out a note afterwards that includes the links, and will tell you when the taped version will show up. So
Great. All right. I'll be sure to get those to you right after we're done here. All right. If anyone has questions, we have some time for questions, or if we don't have any questions, you can all get out and enjoy the rest of your great day before it gets dark there in New Jersey.
So Victoria says, thanks for all the information. I had no idea this was all out there. I want to tell you, if you're hesitant, call the library. We are not open to the public, but we're all here waiting for your questions. We're here to help you with all the devices. We do curbside service. We've got lots of programs. On Thursday, we're doing a program for writers with an author from Chicago. We never would have got if we didn't have Zoom. And on Friday, we're doing a very important program on Black women's long march to freedom, which is going to be great. So I want to thank, first of all, Dana. You've been really informative and useful and helpful, and we really appreciate it. And Linda Fitzpatrick also says thank you for the information. So with that note, I will stop recording and thank you all.
All right. Oh, great. Thank you, Amy.